Hello, everybody, and welcome to episode 45 of the Pet Behavior Chat. And I'm so excited about this episode because it's a topic that I'm so passionate about, and it is feline house soiling. So last week we did canine house soiling, and I want to follow on from that with feline house soiling. And the reason I'm so very passionate about this topic is because a lot of cats get relinquished and ultimately euthanized because of this. And so if we don't do something to address this, cats are going to lose their lives or are going to end up in shelters, are going to end up relinquished, are going to end up in stressful situations. And to me, that's just not acceptable. And I think if we understand a little bit more about normal feline elimination and what causes feline house soiling, I think there's so much we can do, and we really actually have pretty good results in treating feline house soiling. So it doesn't have to be the case that these cats get abandoned and potentially euthanized for this issue. And I actually always have the voice of the amazing, inspirational Dr. Katrin in my ear here. So Dr. Katrin Haupt is one of the founders of the American College of Veterinary Behaviorists. She is a force to be reckoned with. She is somebody who has progressed this field of veterinary behavior medicine immensely over her lifetime. And she's just one of those women who go before all of us, or who went before all of us to make it possible for us to practice this beautiful, beautiful area of veterinary medicine, which is veterinary behavior medicine. And I've listened to her speak on this topic a few times, and she is the one that actually really makes that point about the unnecessary euthanasia, relinquishment of cats that have these feline house soiling problems. And certainly globally, feline house soiling is probably the number one behavior problem that is presented to behaviorists and veterinary behaviorists around the world. Now, for me here in the UAE, that's slightly different. I do see more intercat aggression cases, but second for sure is feline house soiling. And the two sometimes go hand in hand. But it's a topic that I'm really passionate about, like I said, because actually we have pretty decent treatment modalities. And it's one of the presentations that I personally, in my hands, am quite successful at treating. So, I want to dive into this. And obviously you can tell how passionate I am about it. It's really important that we get a few kind of sort of big facts right, or a few big pieces right. And I'm going to approach this a little bit how I did the canine house soiling episode last week. So I'm going to start a little bit with sort of what's normal feline elimination behavior. How can house soiling develop? What are the 4 big silos? So in canine house soiling, we had kind of like 3 big things that I think about. Here it's more 4 things that I think about. And what is going to really help us as vets and also pet caregivers to understand what's going on and what we might be able to do. And in some cases, we have, very kind of simple ways of treating this. In other cases, it can definitely be more complex, but I want to chat you through that all. Now, the first thing I want to say before we dive into all of that is feline house soiling can be really distressing for the caregivers. I've had, a lot of people that, a lot of clients who have told me just how debilitating that is, living with a cat that urinates and or defecates in the home. And it can take a massive emotional toll, and it can massively impact that human-cat relationship as well. And, obviously that's not what anybody wants, because we have pets in our lives to enrich our lives and to bring joy to our lives. Sometimes they can be a massive support, they can be a source of companionship. And so when we have behaviors that really challenge that, I think that can be massively difficult. And I personally have seen and treated really extreme cases of feline house soiling. I've entered homes where literally the entire kitchen has been wrapped in plastic cladding, to protect electrical appliances and to protect, the kitchen and those sort of places that we really feel strongly about in terms of hygiene. And clients go to massive lengths to try and find a way of making this work so that they don't have to relinquish the cats, or that they can continue living with the cats, that the cats can stay in their homes. But eventually and essentially, it's not a long-term solution, and it's just not sustainable for the long term. So we really need to intervene here. And it's not just the clients or the pet caregivers that are sort of sitting with this and really struggling with this. It's the cats themselves as well, because oftentimes, as we'll hear as I go through the podcast, stress can be a massive underlying factor here and can be a massive sort of cause of why feline house soiling happens. So it's a big, big topic. And it's a topic that potentially has, if we get this right, if we get this piece right, and if we find a way to treat this well, we can have a massive impact. We can save lives. We can improve welfare, not only for the cats, but also for the caregivers. So it's a topic that I'm really passionate about. And I really hope that you get something from this podcast today, because it's my goal to show you how many treatment options we do have. And my hope is that by breaking this down into sort of areas that you can identify, and that you can kind of work through this in a logical, kind of almost a flow chart kind of way, that it's going to help you come up with the right solutions. So I want to equip you with this knowledge to go out and be able to at least give the right kind of advice, or refer if you feel that's appropriate, knowing that referral might really make a massive impact on these cases. So that's setting the scene a little bit for that. So why don't we dive into normal cat elimination behaviors? So one of the things that actually always really amazes me is how amazing cats are at learning to use litter trays. I mean, really from a super young age, and we're talking sort of 5 to 6 weeks of age, where cats actually start to urinate spontaneously. So they don't need to be stimulated by mum anymore to urinate and defecate. Almost immediately, they find places that are appropriate, and litter trays provide a really good place for them to be able to eliminate. And I can remember when I brought our little kitten, as she was then, into the home, and we had a litter tray for her. She was a stray. She was rescued. So we're not entirely sure what her sort of previous experiences were before she came to us. She was probably about 8 to 9 weeks when she came to us. But we popped a litter tray in the little room that we kept her. Well, it's actually quite a big room that we kept her in initially, as we were introducing her to the home and to the other animals in the home. And without a shadow, like a second thought, without even thinking about it, she started using that litter tray. So I think that's something that's really quite telling, is how how compliant cats are with actually using litter trays. And sometimes I find that it's those cats that have perhaps early aversions to the litter tray, that from a very young age don't like litter trays, or have built up some kind of a negative association to litter trays, that can go on to really sort of struggle with that. And that, in my sort of opinion, that would be a less common scenario. So the vast majority of cats really take to litter trays really well, as long as the litter trays are appropriate. And we'll talk a little bit about that, as long as they're the right size and, that they're kept clean the whole time. And if you are wanting to get more information about the perfect litter tray, listen to episode 19 of this podcast, where I talk in detail about the perfect litter box and what a perfect litter box should look like from the cat's perspective, not from our perspective, but from the cat's perspective. So that's the first thing. So how does that kind of develop, and how does normal sort of elimination behavior develop in cats and kittens? So as I mentioned, voluntary elimination starts at around 5 to 6 weeks of age. So then they spontaneously eliminate. They don't need to be stimulated by mum anymore. Up until that point, mum kind of licks the perianal area and causes them to urinate and defecate. If you've ever hand reared a kitten that's been separated from mum, you know that that's something that you kind of have to replicate with maybe a warm towel or a warm, kind of tissue or something like that, and just rub that area to stimulate them. So 5 to 6 weeks voluntary elimination. And then from 5 to 7 weeks, they start using the litter box, which again blows my mind. It just blows my mind how they, kind of naturally gravitate towards that. And then from about 7 weeks of age, they start to cover. And I'll talk a little bit more about that in a second, but they start covering their eliminations in the litter box, which is a really normal piece of that whole kind of feline elimination pattern. Now, talking about that, what is the pattern of elimination? What would we expect a normal cat elimination pattern to look like? And there's a great paper by Sung and Crowell Davis, which again I'll put in the show notes, to say that this is what the pattern looks like. So initially, before they eliminate, they'll dig for about 12 seconds. After they've eliminated, they'll sniff for about 18 seconds, and then they'll spend another 12 seconds covering their eliminations. So that's what we would expect to see from a kind of a normal elimination pattern. And already, if we see kind of differences to that, if we see that that's not happening the way that it should be, that can maybe be a little red flag. It might mean that the cat's not entirely comfortable with the litter tray. Often that's to do with size. That might be to do with other cats in the environment, or not feeling safe to be able to perform that very sort of common pattern and sort of intrinsic pattern that they go through. So yeah, really important to kind of know what's normal. As I mentioned also in the Feline House Soiling podcast, we have to know what's normal in order to know what's abnormal, and in order to try and understand those fine nuances and pieces that we can kind of tap into and that are going to inform our treatment plan. So that's a little bit about what normal elimination would look like. So cats would normally urinate about 2 to 5 times per day. That's sort of a normal urination frequency. And they would defecate at least once a day. Some cats go to every other day. I've seen that before as well. And that can be a normal pattern for some cats. That's where you have to sort of get individual knowledge of your particular cat. But yeah, we should be looking for defecation at least once a day. And we should also be monitoring what their stools look like. So there are some amazing fecal charts, which is not the most kind of sexy thing to talk about, but there are some really great poop charts, if you like, where you can actually grade what your cat's feces look like. And that again informs us to see whether that's normal, whether they might be having loose stools, if they're having diarrhea, because again, that can influence the frequency of defecation, and that can also influence perhaps why they might defecate outside of the litter box. So when we talk about feline house soiling, we talk about urination and defecation, and we're going to break this down even further into different types of elimination behaviors. And this is super, super important, because the very first thing that you probably need to understand is if the cat is peeing outside the litter box and is urine marking, or if they're emptying their bladders, if they're urine voiding. And those are kind of almost the first two silos, right? So are we dealing with urine marking, or are we dealing with bladder voiding, and they're just looking for a different, maybe more attractive place where they feel more comfortable, safer to empty their bladders? And again, there's a really interesting piece of research looking at, vets who are presented with feline house soiling, how many vets actually make that distinction or actually ask those questions? You know, is it urine marking or is it urine voiding? And a third of vets don't make that distinction, and a third of vets perhaps don't ask those questions, and that might be just because they're not familiar with that sort of distinction, or maybe they don't have the time to go into that. But a third of vets don't kind of get that piece right. But of the 2/3 that do get that piece right, they are much more likely to recommend appropriate treatment strategies and solutions. So it's a really, really important piece to differentiate between marking and voiding. Now, I want to caveat that with it's not always quite as straightforward as that. So sometimes, marking can be disguised as voiding, and voiding can be disguised as marking. And I'm going to tell you what the difference in the two is. So urine marking is a completely normal feline behavior. And it's one of the strategies that cats use to demarcate their territories. So they will patrol the perimeters of their territories, and they will deposit urine marks at sort of really appropriate locations. And it's one of the strategies they use in order not to have to physically encounter other cats that are perhaps trying to infiltrate their territories. So cats are really great at avoiding physical face-to-face conflict. And the way that they do that is by putting these kind of urine marks, not just urine marks. There are other ways of marking territory as well, but urine marking is a big one of them. And any other cat that might be approaching that territory and thinking, oh, I might see if I can actually take over this territory. When they smell the urine marks, they understand, actually, this is the perimeter of another cat's territory. And the urine marking has a lot of information. So the smell of the urine can give a lot of information to that potential intruder about, the fitness and the size and, the kind of sexual fitness and prowess of that cat, the emotional state of them, potentially how long they've owned that territory for. So it gives a lot of information to the potential intruder, and the potential intruder can then make a decision as to whether they want to take their chances and see if they can take over that territory, or at that point they might just turn around, back away, and that communication strategy was effective. So it's a normal feline behavior. It's much more prevalent in male cats. So we see, up to 85% of male cats performing that behavior. It's less common in female cats, although female cats also do that. But the good news is that neutering male cats can reduce that urine marking behavior by 90%. And that is massive. 90% is a big number. And when we're looking or thinking in the context of veterinary behavior medicine, there aren't many instances where we can make a 90% improvement easily by employing a certain strategy, which would be neutering, which is, quick, safe, and something relatively easy to do. So if you have an unneutered male cat that is urine marking, that would be the first thing that you would need to think about. Now, if your cat is neutered and they are still urine marking, they could either be falling into that 10% of cats that are neutered that still urine mark, but more importantly, they could be urine marking for other reasons. And those are usually to do with stress, social conflict, desperately demarcating their territory. This happens a lot in multi-cat households where marking your territory might not be successful because you have a number of other cats living in that same territory with you. And, no matter what you do to try and demarcate your territory, the other cats are going to still be there. And that can cause a lot of frustration because, the normal strategy that would work in a natural setting perhaps isn't working in that domestic setting, especially if you have multi-cat households. So how can you recognize whether your cat is urine marking or whether they're actually voiding. And there are a few telltale signs, and you usually need to kind of look at a combination of signs to try and understand, what's really going on here. So for urine marking, the posture that the cat adopts is really typical. So they'll usually be standing upright. Their tails might be high and erect. The tails might quiver. They might start to kind of tread with their back legs, and they will kind of spray in a horizontal fashion against vertical objects. So they might spray against a piece of furniture. They might spray against the wall. A classic one is spraying against windows or curtains that are perhaps, leading out to the outside environment, especially if there are stray cats in the vicinity, because again, it's that whole demarcation of territory piece, and they're trying to let the stray cats outside know, hey, this is my territory, don't even bother trying to come closer. So that's what it traditionally looks like. So upright stance, erect tail, small amounts of urine, sprayed out, treading legs, quivering tail, and it's usually on a vertical surface. Urine voiding looks much more like a normal kind of urination behavior. So the cat might do the digging that I mentioned earlier outside of the litter box. So I've seen so many videos of cats kind of digging, even if it's on a tile, because it's part of that behavioral repertoire. And then what they'll do is they will squat down, usually on a horizontal surface. Could be the floor, could be a bed, could be in a wash basket, on the dirty laundry, on the clean laundry, oftentimes in kind of quiet, secluded spaces. This might sound familiar to some of you. And they deposit a large amount of urine. So they're completely emptying their bladders. And it looks very, very different to urine marking. So that's already a relatively easy distinction that you guys can make, whether you're a pet caregiver or whether you're a vet or a vet nurse and you're trying to kind of get to the bottom of what's going on. Those are the first questions you need to ask. Is it urine spraying or is it urine voiding? Now, here's the tricky piece, is that sometimes they can throw us red herrings, right? And I've seen cats who have sprayed on horizontal surfaces, and sometimes the amount isn't just tiny droplets, it can be slightly larger. And here is where videos can be really, really valuable, and also looking at the bigger picture, the context of what's going on. Again, do we have multi-cat households? Do we feel this cat is showing other signs of stress, perhaps? And their urine marking on horizontal surfaces that isn't that kind of classic picture that I've just described. And to be honest with you, these are sometimes cases that really require the input of a veterinary behaviorist. So this is often where I get called in, where there's confusion about what's going on. It's not clear. It's not clear cut. And, we need to try and dig a little bit deeper and find out a little bit more about the general context and what's going on. So those are my first two silos, and it's really important. And sometimes what's really interesting, I have a couple of amazing pictures and videos of clients' homes that I've gone into that have sent me those pictures and videos before I've gone. And one sticks in my mind massively, which is a lovely, lovely client of mine that's become, an advocate and a good friend of mine, who had a cat that was literally urinating everywhere. And when she sent me the photos, and in fact, when I went into the home, she had pee pads taped all up the walls. So the majority of the walls in her home, there were pee pads taped to them. So pee pads taped to vertical surfaces at the perimeter, all around the walls, in very sort of key areas. They could be areas of passageways where multiple cats pass. So this was a multi-cat household. And almost just from looking at that picture, I was able already to make a bit of a judgment call in my mind to think, this is probably urine marking because of the location and the very obvious visual representation of that, of all these pee pads that had been kind of taped up the vertical surfaces of the walls. So there's a lot of information that can be gleaned from that. But remember, there can be the red herrings. So keep an open mind if it's not massively clear cut. Then again, I've had other cases where it's been so clear that, the cat has voided, in places that were just more comfortable for them. So again, I had one case, a lovely cat that we completely solved, that was urinating in the middle of the lounge, in the middle of the living room. And, luckily the client had some fantastic kind of home cameras where we could see exactly what the cat was doing. And they were showing that classic behavior of digging before, sniffing afterwards, trying to cover, afterwards, which was not possible because it was on tile. But that was a relatively clear picture of, this is probably urine voiding and has something to do with the fact that the cat's not comfortable with the location of the litter box, the size of the litter box, the cleanliness of the litter box, maybe some social conflict. There was a second cat in the home that they just didn't feel safe and comfortable to go to that litter box because maybe in the past they'd had a negative experience in there. Sometimes we get cats stalking each other when they're in the litter box and really bothering the cat that's in the litter box, so they're not able to perform, in privacy, their elimination behavior. And that's when sometimes you don't get that kind of digging behavior afterwards. The cat kind of, does their business, and then they're like, oh my God, I'm being watched and stalked. I just need to get the hell out of there. And they don't go through that full repertoire of behavior of covering the elimination. So those are the two sort of first pieces. Now, the third piece, and this will be no surprise to you if you know me, and if you've listened to previous podcasts, the third big piece is physical medical, always. And perhaps this should be one of the first things that we look at. So there are a number of physical medical reasons why a cat might be urinating and or defecating outside the litter box. So obviously we've got pain. That's a massive piece. So let's say an older cat that maybe for all of their lives have used the litter box perfectly, and all of a sudden they stop using it, even though nothing has changed. The thing that might have changed is that cat is feeling painful, maybe feeling some musculoskeletal pain, and the physical act of getting into the litter box, especially if the litter box is too small, is just not comfortable for them, and they decide to use a different location. So pain is really an important piece to look at. And again, this is where videos can be really important. You might see the cat go up to the litter box, think about going in, and then at the last moment they decide, actually, no, this is just not worth it. It's too sore. I don't feel happy and comfortable. I'm just going to go somewhere else. On the floor, on the bed, on the rug. And sometimes it can be, let's say the litter box is located in a bathroom, which it is in many households, and you have a bath mat next to the litter box. That's sometimes when the cats decide to go on that bath mat next to the litter box, because it gives them some kind of substrate, but they don't have to climb into the litter box. And here, treatment can be relatively simple. We provide more appropriate litter boxes with much sort of shallower lips for them to get in. And it can be as simple as that. Or let's say a cat is in pain and has to make a long journey to get to the litter box. Let's say the litter box is located in a basement or up on the third floor, and they need to kind of trek all the way up there, but they're quite sore and navigating the stairs is not easy. So that might be another concern. Other physical medical things to think about is anything that causes the cat to drink more and therefore urinate more. So we are thinking about diabetes, kidney disease, hypothyroidism, liver disease potentially, maybe other endocrine issues such as Cushing's, which is rare in cats, but we need to keep an open mind. So if the cat is urinating more, and you can often tell this by the fact that the litter box is heavier than it was. However, the litter box might be soiled much more quickly, and the cat therefore thinks, oh, it's already kind of soiled and wet, now I need to go outside. So that's another thing to consider. Also, sensory changes. So as cats get older, their vision might not be as good anymore. I had one super interesting case, a cat that was presented for Feline House Soiling. And it turned out that the cat was blind in, I think, at least one eye fully blind. The other eye had perhaps partial vision. And we ended up diagnosing that cat with glaucoma. We treated that cat. The one eye that was non-visual and very painful was enucleated. And, all of a sudden that improved things. And yes, cats can locate litter boxes by smell. But if they are visually impaired, and the other thing that was happening in this case was that the client was constantly changing the location of the litter box because, they thought, gosh, if I put it in a different location, she might be more willing to use it. But that frequent changing of location just made things worse because of the visual impairment. So sensory issues are something to think about. The other thing we want to think about, obviously, are urinary tract diseases and anything that potentially could cause incontinence or bladder issues. So we're thinking about neurological disease here. Particularly, we're thinking about any impairment that comes in the lumbosacral spine. So the nerves that are responsible for normal micturition or normal elimination are located in that kind of lumbosacral area. So, neurological deficits could also be something to consider here. So full medical workup, thinking about all the body systems that could be involved in changes in elimination. So now I've just spoken a lot about urination, but I want to talk about defecation as well. And again, anything that could cause gastrointestinal issues, gastrointestinal upset, inflammatory bowel disease is a massive piece here. And, we've had cats that have defecated outside of the litter box, and something as simple as a change in diet to a hypoallergenic diet can resolve that issue. So again, thinking about the medical. The other thing to think about, just as we're on the topic of defecation, is if a cat is urinating and defecating outside the litter box, potentially it's more likely that the litter box location, the way it looks, the way it's cleaned is perhaps not suitable. So that litter box aversion piece is maybe higher on my differential diagnosis list if we've got urination and defecation out of the litter box. So again, details to pick apart and things that lead us down this flow chart or algorithm of coming up with a working solution that we can start to consider a treatment plan for. Okay, so that's my big box number 3, which is physical medical health. And then my box number 4 is an interesting one because it's the perfect kind of interception between the medical and the behavioral. And I'm talking here about FIC, or feline idiopathic cystitis. Now, I have an incredible podcast episode that I did with Dr. Gael Joanny, where we talked a lot about FIC, and that is episode number 30. So if you're interested in really kind of getting a deep dive on that, then please go and have a listen to episode 30. But what I do want to say here is that FIC, or feline idiopathic cystitis, in the majority of cases is a disease of stress. So it will usually present in younger cats. So we're talking about cats that are less than 10 years of age. They can present as kind of waxing and waning episodes. So the cat might show signs of cystitis. Now, signs of cystitis can be frequent visits to the litter box, and urinating for small amounts, straining to urinate. There might be blood in the urine. They might vocalize as they're urinating because it can be really painful. If you've ever suffered from cystitis yourself, I have. It is horrible. It's painful. It's nasty. It burns. It hurts. And oftentimes the cats then associate that negative, nasty feeling with the litter box, and they'll start to go outside of the litter box. So if you see small puddles, frequent urination, and I'm talking, this can be sort of every couple of minutes, the cat, strains to urinate, adopts that posture. And like I say, there might be sort of blood tinged in the urine, then those are the signs for cystitis. And in younger cats, as I said, 75% of those cystitis cases will be related to stress. So if we manage stress in those cases, along with a few other things such as diet, making sure that pet caregivers don't punish their cats in those instances, that they get some, support in terms of pain relief and so on. Those FIC cases it can be really sort of classic in appearance. So, like I said, the waxing and waning is interesting because the episodes can be self-limiting. So it could be that the cat displays cystitis for a few days and then it might go away. And then, maybe a few weeks or even a few months later, they have another episode and then it goes away. However, the underlying cause in many of these cases, 75% of cases, is stress. So we absolutely have to address the stress in these situations. And again, that's where the help of a veterinary behaviorist or, somebody who's really clued up on this and that can refer to a vet as necessary is really, really important. Now, we do have obviously those other 25% of cases. And so what do they present with? And stones, so bladder stones is probably the second biggest thing on the list here. So that's something to consider. And in both the stress related as well as the sort of calculi or stone related cases, the risk of that is that the cat ends up blocking. And what do I mean by that? So in the case of FIC, the stress-related disease, you'll often have a number of inflammatory mediators swimming around in the bladder. They might congregate together with some sediment and some mucus, and they can form these urethral plugs that go down the urethra, which is the tube that leads to the outside, and they might plug it. And this is when cats are no longer able to urinate. And that is a true emergency situation. So it's really important that we prevent this from happening and that we, as much as possible, manage these situations so that we don't end up down the line with an emergency and a blocked cat coming in. So that's really, really important. So those are the cats that are under 10 years of age on average. I mean, I'm saying 10 years as a cutoff point because that's what's usually mentioned in the literature, but a younger cat. In older cats, that can look different. So in older cats, we much more frequently get cystitis or, bladder infections secondary to bacterial infection. And this is usually a result of a metabolic disease. So you might, again, have diabetes or renal disease. All of a sudden, the urine isn't able to concentrate as well as it should. So the kidneys, perhaps if the kidneys aren't working, the urine isn't as concentrated. If the cat's drinking more, the urine won't be as concentrated. And that concentrated urine is usually that natural line of defense for bacteria and infection. And if that isn't present anymore, we leave the environment open to getting secondary bacterial infections. And this is really where we need our full medical workup. We need a urinalysis, we need a culture and sensitivity, we need x-rays again to look for stones, or abdominal ultrasound to look for stones. We need blood work to look at kidney function, look for diabetes, look for other signs of metabolic disease. And we really want to be addressing that in a comprehensive way. So it's really interesting. And I think it's something that potentially vets struggle with. I know that my team sometimes finds it quite confusing to, understand, like, whoa, like, cat comes in with cystitis. What do we do first? What's our approach? Where do we go from here? Do we take a urinalysis on every single cat? If they're a younger cat, you might not have to. And again, there's some great research to show that younger cats with cystitis don't necessarily give us a lot of information on urinalysis. In an older cat, absolutely, you do need to go for a urinalysis. In a younger cat, you want to be ruling out stones and perhaps sort of other potential medical causes, although they're much, much more rare. And for these young cats, it's really about having a conversation about the environment, trying to understand what are the stressors. I often encourage clients to make a list of stressors, maybe together with the vet or together with the veterinary behaviorist. We come up with a list of what are all the things in the cat's life that might be causing them stress. And classic ones here are living in a multi-cat household, having perhaps other pets in the home. Maybe there was a recent addition to the family, a baby. Maybe there was a change in social dynamic in the household. Maybe there was a move to a different home. Maybe we've got stray cats outside that are causing stress. Maybe we've got construction or building work going on in the home. And I've seen all of these examples in my cases. And we really need to kind of play detective here and try and understand what's causing the stress. And we need to be addressing that stress. And so obviously, that builds the foundation of our treatment plans, is addressing those things. So stress for FIC and for urine marking are very common denominators, and environmental management and optimization of the litter box and the environment, where they do eliminate. That's usually more of a common theme when it comes to feline house soiling. And obviously, if there's a medical concern, we need to address that. Pain management and assessing and addressing all of the other physical medical issues. So that was quite a lot, and that's how I work through my feline house soiling cases. But actually, there's a logic to it. There's a flow chart to it. There's a flow to it. There's a way of understanding or looking for and, getting to grips with some of these cases. And once you've seen a few of these cases, it will become easier. But for all the vets that might be listening to this, probably the most important thing you can do is try to differentiate between urine marking and urine soiling, because that's going to massively inform the way you go forward. Now, I'm not going to hugely go into treatment plans here. We'll discuss treatment for feline house soiling another day. We'll talk about all the environmental management. We'll talk about all the medication. We'll talk about all the supplements and the pheromones that we can use to help. But it was really important to me today to give an understanding and a glimmer of hope that these cases absolutely can be treated. And honestly, when I get a feline house soiling case, my heart delights, because I know that I'm going to be able to make a difference here much more easily than in some of these intercat aggression cases that can be much, much harder to address. Right, let me just see if there was anything else that I wanted to talk about. No, I think I've covered everything. And again, 3 other great podcast episodes in this podcast series to look out for and listen to if you want a little bit more information about feline house soiling. The first one is episode 18, where Nora and I chat about the 5 pillars of a feline healthy environment. And that does address, the importance of litter boxes and how that plays a role. Obviously, episode 19, the perfect litter box optimization is going to be part of every feline house soiling treatment plan, whether it's marking, whether it's soiling, whether it's defecation, the perfect litter box is always going to be there. And then if you want to take a deep dive into FIC or feline idiopathic cystitis, then please have a listen to episode 30, which is my episode with Gael Joanny. And we talk a little bit more about sort of the mechanics of FIC and what actually physiologically happens in the body, because it's a pretty interesting disease from a physiological point of view. And there are some parallels with human interstitial cystitis. And, you know, I think we're still doing quite a lot of research on this, but there are some really complex and quite amazing immunological processes that go on. It's a very, very interesting disease. It's obviously not nice for the cats at all, but it's quite fascinating. So have a listen to episode 30 if you would like a little bit more information on that. Okay, so I hope I've whet your appetite for being a little bit more confident in thinking about how you can help these cats with feline house soiling. And again, remember the high relinquishment numbers. So the Salman et al. Study from 2000, which I'll also link in the show notes, states that 28% of cats in this particular study, 28% of cats that were relinquished to shelters were relinquished for behavioural reasons. And of that 28%, 43%, almost half, were relinquished for house soiling issues. So that gives you a bit of an idea of the scale of this problem. And I passionately believe that we can do a better job here, and that we can impact lives more, that we can change lives more, that we can touch lives positively, whether that's the cats and or the caregivers. Obviously, you know, both are involved here. And if you are a caregiver, reach out. We can help you with this. And it's not something you need to be embarrassed about or feel, you know, concerned about. I've had a lot of clients say to me, I can't invite you into my home for a home visit because it smells of cat pee. There's cat pee everywhere. And I feel bad. I feel embarrassed. It smells bad and I can't have you come into the house. And, you know, it takes a little bit of conversation to say, hey, I've seen it all before. And usually when I get into the homes, it doesn't actually smell, that badly of cat pee, but we can make such a massive difference to these cases. All right, I'm going to love you and leave you with that. Thank you for joining me here. And I'm going to see you next week for episode 46. Bye for now.